Hi, I'm Ryan Greening, Vice President of Sales and Marketing at Medspira. Thank you for taking a few minutes today to view a brief overview of the Medspira breath hold. Since the breath hold's introduction, we've been excited to see its usage expand from its original function of assisting radiologists during needle biopsies to now being utilized across several different modalities. With that in mind, our demonstration today will focus solely on the breath hold, a basic overview, the setup, and its functional use. Our setting here today is meant to represent any number of clinical environments where the breath hold can be used. Our video today will contain core components of the breath hold, setup of the clinical environment, placement of the belt on the patient training, teaching the patient that they're a very important part of the procedure or treatment, and finally clinical usage, making sure the clinician knows how to use the breath hold in any type of clinical environment. So let's begin. Let's first introduce the components that make up the breath hold, starting with the base unit and remote displays. The base unit functions as both a display of patient respiratory motion and as a charging bay for the 3 remote displays. Now keep in mind the base unit has an on-off switch on the left-hand side that needs to be activated before beginning use. Each remote display needs to be turned on by activating the on-off switch on the right-hand side. All displays and base unit are running off battery power. There's also a power cord that plugs into the left front side of the base unit for charging purposes. The orange battery indicator light for all 3 remote displays and the base unit appears on the left-hand side. If you do not see the orange light, it means the base unit or display is sufficiently charged. If you see a rapidly blinking orange light, the unit or display needs to be charged and should not be used until charged. Now keep in mind the base unit does not need to be plugged in during a procedure or treatment. It can run off the battery, typically through a first shift, and charge overnight. Now the patient is key in controlling respiratory motion and therefore needs to have a very clear view of a remote display. The breath hold ships with what we call a gooseneck that sits underneath the patient's head and pillow. It is flexible and can be manipulated as needed. It allows the patient to comfortably view a display in an area where that would not normally be possible. Finally, we have the bellows, belt, and pads. The tubing on the belt plugs into the right-hand side of the base unit, and you will hear an audible click when it is properly attached. The belt wraps around the patient, and the pads are placed around the bellows section of the belt. The pads are meant to keep the patient's heat from affecting the bellows over time. Now that you're aware of the breath hold components, let's discuss where to locate them in the clinical environment. Let's cover the suite setup. The first thing you'll want to do is make sure all components are powered on, as mentioned previously, and the remote displays are synced up with the base unit. Each remote display should flash briefly when dropped into the base unit, and then go solid as it syncs up fully. Now you'll want to place the remote displays in their proper locations. We recommend one in the control room for the team to view, one for the physician mounted to the hardware itself, and of course the third one mounted to the gooseneck for the patient. The base unit itself can be placed wherever is convenient in the suite, either on a cart or on a table if you are in that type of environment. Once fully charged, the breath hold does not need to be plugged in during a procedure or treatment. We recommend charging it at night if necessary. The gooseneck should be placed under the patient's head and as far back as possible so as to not interfere with the equipment. Keep in mind there are cases, especially if the patient is prone, where you will not need the gooseneck. Finally, make sure all automated commands are turned off on the equipment, as they can interfere with the manual commands made to the patient. At this point, we will turn our attention to belt placement and how critical it is in the effectiveness of the breath hold. In the field, it is the most common area where issues can occur because there is some variability to it based on the size of the patient and what type of breather they are. The first step in the process is to make sure the belt is plugged into the base unit on the right-hand side. Before placing the belt on the patient, have the patient in position to begin the procedure or treatment to minimize the movement of the patient after positioning the belt. You can now begin placing the belt tightly around the patient's abdomen area. Please make sure it is placed directly on the patient's skin. You will want to use the full Velcro strip when placing the belt around the patient, and do not weave the Velcro strap through the loop at the end of the belt. The key is make the belt tight enough that it cannot move, but not so tight that the bellows cannot flex. Our goal is to see 2 inches between the pads, or 12 inches from black pin to black pin. The blue pads on the belt should always be facing the ceiling, no matter what the patient's position is. The breath hold does not care if the patient is prone or supine. The belt can go on the back as well as when the patient is prone. The rule of thumb is pads should always face up. Keep the rubber tubing from being pinched and don't allow it to lie underneath the patient. Now allow the patient to free breathe. You should be seeing consistent light movement on all your displays. If you're seeing very little movement of lights, a belt adjustment may be needed. Our recommendation is to start with checking the tightness of the belt. If the belt is pretty snug, but still not seeing movement, then determine what type of breather they are and move the belt accordingly. If they're a belly breather, slide the belt down slightly. If they're a chest breather, move the belt up above the abdomen. However, the rule of thumb is always start with the abdomen, and if necessary, move the belt based on your observation of the patient. With the belt placed properly, now push one of the blue arrow-shaped buttons on either a display or the base unit. This zeroes out the unit and allows you to begin the procedure or treatment. Now, before we begin the procedure, it is important that the patient is trained properly. The patient is a very active participant when using the breath hold. There is a patient education video that comes with the device. We recommend that patients get a copy of that to view before coming into the facility. Beyond that, we recommend taking a few minutes with the patient and remind them how important they are in using the breath hold. Have the patient practice inhalation and exhalation. Let them view the lights moving to the right and left. Then have them take a practice breath hold of some sort, maybe at full inhalation. While they are holding their breath, push one of the buttons shaped like a blue arrow. You have just set your hold point. Now have the patient practice coming back to the center light and holding their breath. The center light has the black lines above and below the LED. That center light corresponds with the hold point you just created and is now their target hold point on your command. Now, if you're training them to simply free breathe within a certain range, for example, 3 lights to the right, 3 lights to the left, then simply have them practice that a few times. It will allow them to get used to the amount of respiratory motion they need to move the lights. To end the training, we always recommend walking them through the steps in the treatment or procedure and how the breath hold will come into play, reminding them that all they need to do is return to the center light on your command and hold. At this point, all the components are in place, the suite is set up, the patient has been trained, and now it's time to walk through using the breath hold clinically. Please take the desired breath that you prefer and hold. While the patient is holding, push any of the blue reference buttons to capture that hold point. They now have that target or home that we spoke of earlier. Again, the home spot corresponds with the center red light with the black lines above and below. This home target is a particular spot in the respiratory cycle that you prefer to use. It could be full inhalation, full exhalation, or even a specific range of breathing. It does not matter what the point is. It just matters that you pick a spot that you want to work with and make sure the patient consistently returns to it on your command. A couple of points to mention. Keep in mind that the distance between each LED light is considered 2 millimeters of respiratory motion. Also, if you're only seeing light movement in one direction, that's fine. That simply means your reference point is set at full inhalation or full exhalation. With the home reference point in place, you can now begin the procedure or treatment using the breath hold. On your command, the patient will return to the home center light and hold. Depending on your application, you can now take your image or get your first acquisition of data. When completed, have the patient resume breathing freely. From then on, it is just a continuation of the process. Whenever necessary, have the patient return back to the same point for the introduction of the needle, more data acquisition, etc. The clinician can now have the confidence that the patient is returning to the same place in the respiratory cycle, eliminating the variable of respiratory motion. There are also times when the breath hold can be used for a consistent breathing motion, or even simply as a breathing helper for the patient. The concept always remains the same. Use the lights to help your patient become more consistent. Do not be afraid to change the reference point in the middle of the treatment or procedure. If the breath hold positioning is not where you want it, simply have the patient breathe in the manner you prefer and reset the hold point by pushing the blue button. The patient's goal remains the same: get to the center red light. And repeat these steps as needed throughout the clinical procedure. Thank you for spending a few minutes with us today. Every day we hear from doctors and technicians that they are amazed at how such a simple device can make such a difference in patient treatment and outcomes. The breath hold is simple to use. However, there are key points that are critical to achieve optimal performance. Along with the video, you'll also find a quick reference guide in your case. Of course, we also hope that you will contact us with any questions or concerns. Whether you're using the breath hold in a CT-guided biopsy or radiation therapy or any other application, we're proud to be a part of the best possible care for your patients. Thank you.